Today, we're diving into Ireland's massive new strategy to bring artificial intelligence right into the very heart of its healthcare system. And let's be clear, this isn't just about a few new gadgets. This is a plan for a complete rethink of how healthcare is delivered.
So let's jump right in, because before you can really get why this is happening, you have to understand the sheer scale of the problem. Why does a system as important as healthcare need such a radical change, and why right now?
And that's really the big question, isn't it? Our healthcare systems are under an insane amount of pressure. Can a technology like AI actually be the solution we've been looking for? First, let's unpack what those pressures really are.
Just look at this number, 9,000. It tells you so much. That's how many extra nurses Ireland is projected to need by 2035. It's a huge gap, and it perfectly captures one of the biggest crises in healthcare today, a workforce that is stretched to its absolute limit.
And, it's not just one thing. It's like a perfect storm of challenges all hitting at once. We've got more people, and we're all living longer. We, as patients, rightly expect better and faster care. And all of this is happening while the system is struggling with staff shortages and burnout. This is the why behind this huge push for something new.
So, faced with these enormous challenges, what's the plan? Well, let's explore Ireland's vision, a national strategy that they are calling AI for Care. And this is it. The AI for Care strategy is Ireland's really bold answer. It's a comprehensive plan to use technology not just to patch up holes in the old system, but to build a brand new, smarter, data-driven one from the ground up. All with one goal: better health for everyone. And here's the official vision. I want you to pay attention to two words here: safely and responsibly. The goal is absolutely transformation, but with these crucial guardrails built in to make sure it helps both the people getting care and the amazing professionals providing it.
But okay, a vision is one thing. How do you actually do it? How do you make it a reality? Well, the whole strategy is built on 4 key pillars that act as a practical roadmap.
And here they are. You've got clinical care, operations, research and innovation, and public health. Each one of these targets a different, absolutely vital part of the healthcare system. So let's break them down one by one.
Okay, first up, AI for clinical care. This is all about putting incredibly powerful tools directly into the hands of doctors and nurses. Think of AI that can help spot a disease earlier on a scan or suggest a personalized treatment plan based on data from millions of other cases. It's like giving every clinician a super smart co-pilot to help them make the best possible decisions. And the impact of this in the real world is, well, it's profound. For a stroke patient, every single second counts, and studies show that by using AI to streamline their care, from the first scan to getting them into surgery, you can save an average of 22 minutes. That's not just a number. That's time that literally saves brain cells and can completely change a patient's outcome.
All right, let's move to the next pillar: operations. If clinical care is about the medical side, this is about the engine room of the healthcare system. AI here is all about making things run smoother, faster, and way more efficiently. From automating endless paperwork to finally cutting down those dreaded waiting lists. Just take the supply chain, for example. It's this huge, complicated background process. By using AI to predict what's needed and where, some systems have cut their inventory costs by up to 30%. And think about what that means. That's money that isn't just sitting in a warehouse. It's money freed up for more beds, better equipment, and more staff on the front lines.
The third pillar is research and innovation. And honestly, this is where things get really exciting. This is where AI could seriously fast-track the future of medicine. We're talking about analyzing massive data sets to find patterns humans would never spot, speeding up clinical trials, and ultimately discovering brand new treatments and therapies faster than ever before. And here is a fantastic example of this in action, happening in Ireland right now. Researchers are building an AI tool to help diagnose preeclampsia, a really dangerous complication in pregnancy. And this isn't just some local project. They're tackling a global health problem that affects 1 in every 12 pregnancies worldwide. It's a huge deal. And that brings us to the final pillar, public health. This is a real game changer because it's all about shifting the focus from just treating people when they get sick to actively keeping whole communities healthier in the first place. It's about prevention, not just cure. You can see this perfectly in things like national cancer screening. Traditionally, you need 2 different radiologists to check every single scan. A study in Sweden found that using AI as a first read not only cut the radiologist's massive workload by 44%, but it also detected 29% more cancers. It's a clear win-win. You get better results while taking the pressure off the experts.
Okay, with all this incredibly powerful technology, we have to ask the most important question of all. How do we make sure it's used ethically? How can we actually trust it with our health?
Well, the whole strategy is built on these 6 core principles. And these aren't just buzzwords. Think of them as the fundamental rules of the road. The system has to be person-centered, it has to be transparent, and, critically, it must always have a human in the loop. It's all about building trust from day one.
And let's just focus on that human-in-the-loop idea for a second, because it is arguably the most important one. This is not about replacing doctors and nurses, not at all. It's about empowering them with an amazing tool that takes care of the routine work, analyzes all the complex data, and frees them up to do what they do best: care for people.
So we have the vision, we have the pillars, and we have the principles. What's the actual timeline for a huge transformation like this? How's it going to roll out?
Well, it's a phased plan. Right now, the focus is on proven wins, things like improving diagnostics and medical imaging and automating tons of paperwork. Then, over the next couple of years, it's going to scale up to things like optimizing entire patient journeys. And looking further into the future, we're talking about really groundbreaking innovations like AI-assisted surgery and truly personalized medicine.
So, the strategy is clear, and the roadmap is all laid out. This is going to fundamentally change how healthcare is delivered in Ireland. Which leaves us all with one final thought to consider. When this technology is fully integrated, how is it going to change your next visit to the doctor?